Okay, good morning to all of you out there. Welcome to the program agenda. I'm your host, as always, Cito Beltran, welcoming you to today's episode, September 14, 2021. It's a Tuesday. And today we are going to keep you updated or get you updated on the situation in the country because marami siguro sa inyo, there are a lot of you who have taken these things for granted. You have taken the statistics for granted. You have just basically hunkered down in your own place or just carried on with life. Bahala na si Bathala. Ay, maganda yun. Hindi na bahala si Batman. Bahala na si Bathala, referring to the God Almighty, because parang a lot of people just feel, hey, what can I do? So I will just live my life and carry on. But it is good to be informed because it reaffirms what actions you are taking and whether what the things you are doing are correct. Kasi po, mukhang concerned, quite concerned ang OCTA Research Group, particularly Professor Guido David, and that's why we've invited him to the show later para magkaalaman talaga. And I will give you a small discovery of mine why certain pro-administration congressmen and congresswomen have been moving heaven and earth to stop the OCTA Research Group from disseminating their analysis, their forecasts of data provided or based on data gathered by the Department of Health. Hindi po kumukuha ng datos ang OCTA kung saan-saan. Nagmumula po yan from the most authoritative source. Kung tutuusin nga, medyo authoritative might not be precise because alam naman nyo sa government, when it comes to disasters, they are the last to confirm the number of deaths. Nauna na yung media, nauna na yung mga local government sources. Pero pagdating sa national government, careful sila. So, often their data is delayed. So kung tutusin, baka mas malala pa nga ang sitwasyon with COVID-19. But anyway, we're getting ahead of ourselves. We will get to that later. And today we will also be speaking with someone, who can tell us, teach us hopefully, or explain to us, ito bang mga livable cities just before the pandemic struck. I remember someone, a friend of mine from the ADB or World Bank, I think, who sent us some information on the findings of an urban architect planner, international, no? And they said that Metro Manila is finished. Kumbaga, if they were going to base it on all the parameters, traffic, air pollution, congestion, quality of life, etc., wala na. It would be better for most people to leave Metro Manila. That was before the pandemic. Sorry na lang, marami sa inyo hindi nakadinig, nakabasa ng report na yon. So you're stuck in Metro Manila where 40 to 45% of the country's new COVID cases are happening. So maliban sa unlivable, unlovable pa raw for some. So let's talk about livable, lovable cities with our guests later here on Agenda. In the meantime, I just want to remind you that you are watching us via Cignal TV, or you can watch us via Cignal TV on Channel 8 and Channel 250 for high definition. And kung wala pa kayong Cignal TV or nakikinood lang kayo sa sasakyan, you can watch us via facebook.com/onenewsph and YouTube by entering One News PH. You can also download the Cignal Play app And hindi po ako nagbibiro, no? Sabi ko sa inyo, basta isang text laang, ha? I can be reached 0968-704-7736. Wala pong singil yan. Yun lang message na babayaran nyo. Siyempre, kayo nag-message eh. Pero wala, I don't earn any income from that. So, don't worry about that. Before we go to today's interviews, let's first take a look at the front page of the Philippine Star. And there you go, It Bulaga. Okay. Year 2 of remote learning starts. That's the headline of today's Philippine Star. The second year of remote learning started yesterday with DepEd Chief declaring it as triumphant. Okay. Pero according to observers, the second year of remote learning was a year where the classrooms were very quiet dahil wala pa ring mga estudyanteng pinayagang pumasok. Unfortunately, United Nations experts have expressed concern regarding this pattern of the Philippines because the Philippines is one of the few countries left that have not attempted to normalize face-to-face classes or partial face-to-face classes. Most of the countries abroad daw have started face-to-face classes or partial face-to-face. In fact, my daughter who's going to college abroad, kasi mas mura po yung eskwela ang napuntahan niya, ay kahapon online sila, today face-to-face sila, pero limited number. Now, the United Nations expressed concern because it could worsen. Baka lumala raw yung ating education crisis where beginning from the little ones to the adults, there is no contact, no social interaction, no instantaneous consultation between student and teacher or student and professor. So, ito raw po, the problem with this is little by little, the students are losing the essential skills of communication, interaction, etc., etc. And in the long term, the quality and capacity of Filipino students who will become future professionals and business people would be less than the current quality of Filipino professionals and business people. Kumbaga, sa sabong dehado. Kasi nakakulong laging nakakulong, imbis na nakakapasyal, nakakalakad, nakaka-practice, wala. Okay, let's go forward. The top of the front page, the header, Roque says booster shots okayed for healthcare workers, but the Department of Health denied the statement. Yan na po, kasi yan ang problema. According to reports, Presidential spokesperson Harry Roque is in New York, okay, pre-positioning himself for the nomination into the judicial whatsoever of the United Nations. Nagsalita at sabing, balita ko kasi okay na yung booster shot para sa healthcare workers. Sabi ng DOH, teka, that's not the case. We are still studying the matter. Okay, so still studying the matter. Another issue still being studied, okay, is the IATF still discussing yung alert levels na ipapatupad, the different kinds of alert levels that are supposed to be implemented to replace yung ating ECQ, GCQ, MECQ, blah, blah, blah. Okay? It turns out that it was supposed to be implemented September 8. Ano ba ngayon? September 14 na. Nauna yung announcement, yung pala, subject to discussion pa, yung i-implement. Okay, so Malacanang says they're still discussing the different types of alert levels. Ang tawag po dyan, nauna na naman ang dada bago gawa. As they say in the time of President Fidel Ramos, complete staff work. Tapusin ang pag-aaral, okay? Due diligence. Okay. Now let's go down to the bottom half of the Philippine Star. PNP probes online sale of loose firearms. If you got to see some of the news, especially on GMA 7, 24 oras ba yun sa kanila, may ni-raid yung PNP, NBI, I believe, na isang bahay sa Bulacan, if I'm not mistaken, and elsewhere. And they found in Quezon City and Santa Maria, Bulacan, they found an entire house full of different gun parts. Kanya nga lang, the issue there was puro kinakalawang na. And what was discovered was they would get, parang sa surplusan ng mga baril, and they would assemble these guns, refurbish them, and sell them to buyers online. So the PNP now probes online sale of loose firearms. So wag po kayo kung kakagat dyan sa mga nag-a-advertise o titingin-tingin dyan dahil baka kayo ay ma-monitor ng PNP. Okay. Then we have Young Help Finance Family Deals. Okay, that is in the right side of the bottom half. Young Help Finance Family Deals. Ito po ang masaklap. During the Senate investigation yesterday, the suppliers Pharmaceutical Corp, an executive of the company, testified yesterday saying na Michael Yang helped bankroll the Pharmaly deals. In short, walang kapital ang kumapital o naghanap ng financier ay si Michael Yang, who is associated with President Rodrigo Duterte. Sa madaling sabi, yung mga na-involved dito sa pagbebenta, those who were involved in the sale of face masks, face shields, PPEs to the DOH, did not have the money, did not have the capital to process the purchase order, etc. Ang masaklap pa po, the purchase, the order and the purchase were all done within the same day. So talagang malaking anomaly itong Pharmaly na ito. It is an anomaly when a company can actually go and buy products and then end up. Pwede bang makiutang? Pwede bang i-advance nyo muna yung pera? Tapos tutubusin na lang namin ng gobyerno. Anyway, yan po. Michael Yang has been linked, has been pointed as the financier daw ng Pharmaly. Okay. Sara urged reconsider decision to back out. Reconsider decision to back out. Ayan po, may mga nangungulit pa rin kay Mayor Sara Duterte na pag-isipan mo ulit at baka naman pwedeng tumakbo ka pa rin ng presidente. Okay, and I would be bold to make a prediction. I will write that in my next column. The election, the campaign, ano bang tawag noon? Filing of candidacy and the campaign will see the Philippines na puro sliding away. Parang yung parang yung kanta nung sa Simon and Garfunkel, sliding away. Diba? Kasi meron diyang tatakbo ng Vice President pero mag-slide back to Senator. May tatakbo dyan na hindi tatakbo daw pero tatakbo ulit, etc. etc. Naku po! Maraming mangyari dyan. Anyway, Angelina Jolie wins as president. Okay, nanalo na presidente si Angelina Jolie. Okay? in COMELEC's mock internet voting. Ito naman talagang overseas group ng COMELEC. They did a mock election. Naglagay ng kung sino-sinong kandidato ang nanalo. The winner was Angelina Jolie in a mock internet election or voting. Okay, according to the COMELEC. Hi, nako. Well, thank you for the entertaining news. Okay, and last but not the least, we have a photo of the Malaya Thermal Power Plant turnover. Okay, ang nanalo po ay yung Belgrove, Belgrove, Belgrove Company, represented by Sheila Romero. I'm not sure kung ito yung the same Sheila Romero associated with Congressman Mikey Romero. Pero ayan po, no? So that's the front page of the Philippine Star today. And if you want to read more news, kasi marami pa pong balita, hindi ko lang nasasama, we can't include everything because we are essentially, dealing with either a main topic or interviews. Okay, speaking of which, let's now go to the day's quote. Quote of the day comes from Ecclesiastes 3:11. I would like for you to listen, read this. He has made everything beautiful in its time. Also, he has put eternity into man's heart, yet so that he cannot find out what God has done from the beginning to the end. Ecclesiastes 3:11. Okay, there are 2 points of importance there. He has made everything beautiful in its time. Okay, if you are praying, hoping, believing, working for something, just keep on doing it, okay? If you are fighting a disease or fighting an injustice, keep believing that in God's time, it will happen if it is in God's will. Eh kung kayo naman po, if you are praying for revenge, okay? God said, leave room, magbigay ka ng puwang, for vengeance is mine, said the Lord. It is not for us to get our own revenge or vengeance. So that is not the will of God. Anyway, I don't want to preach, pero the good part is in God's time, He makes everything beautiful. So wait ka lang, but keep working. The second part is that He has put eternity into man's heart. Alam nyo, many of us have this feeling na we're going to live forever. Ugod ka na, pero I want to do this, I want to do that. That's kumbaga a trick so that you don't start thinking, ay nako, mamamatay na ako, upo na lang ako dito. Or I'm old already, I might as well just wait and die. I know someone like that. Gusto ko nang batukan yung ali, hindi ko lang mabatukan. She keeps telling me, Cito, I'm old, I want to die. Ano ka mo? 70 ka lang, gusto mo nang mamatay? May sayad ka siguro, no? But anyway, God puts eternity into our hearts. So, kumbaga, we don't try to preempt His plans, okay? We keep believing. But, ang counter dyan sa eternity into our hearts, we pray for God to teach us to number our days, to make every day count. Anyway, it's already 8:19. Baka mapagalitan na ako ni Arbic Tolentino. Let's go to our first guest. Okay, the OCTA Research Group revealed that COVID cases in Metro Manila rocketed to almost 20% with a reproduction rate number at 1.42%. Areko po, ano ba naman? Noon 9 na lang ang pinag-uusapan, ngayon 1.42 for Metro Manila. Kanyo, ha? Last Saturday, the NCR logged its record-breaking cases, reaching over 9,000 cases. OCTA also says that daily tally might reach 30,000 this month, surpassing the all-time high. Ayan na, binasa ko na. Eto na si Professor Guido David. Professor, good morning to you.
Hi, good morning, Cito.
Okay, I caught an interview of yours yesterday, and you were asked the question, do you believe that the worst is over? And I quote, you said, I'm sorry, but that is not the case. Professor David, what is our situation with COVID and Delta cases? Everyone said that after a lockdown, things should improve, but it seems it's getting better, getting worse.
Yeah, unfortunately, Cito. Well, in terms of yung reproduction number, we've been stuck at nasa in the range na 1.35 to 1.45 for mga 2 to 3 weeks now. So kumbaga, in fact, we had a go negosyo talk yesterday. Andun din si Father Nicanor, who's who I discuss a lot with, and then observe namin ang sinabi ni Father Nick. He gave an analogy na parang ondoy na it's slow pero it has been parang staying put, parang hindi pa siya umaalis. Normally, Sito, at least sa mga other countries na nakita natin sa Asia na nagkaroon ng Delta surge, even India, even Indonesia, natatapos siya by 3 months some way, somehow. So tayo nasa 1.5 month period na tayo. The normal expectation is we should be peaking at this time. Pero hindi pa natin nakikita yung peak. But yes, it was frustrating last Saturday kasi we had record high numbers. 9,000 cases sa Metro Manila, 26,000 sa Philippines. Of course, part of that is due to backlog. Pero I don't know, medyo optimistic ako because of yesterday's numbers, and Tuesday and Wednesday usually lower numbers. So we might see a glimpse of hope with the numbers we're seeing this week na baka bumaba yung reproduction number. We're hoping it would go down to nasa line of 1.2 para medyo malapit na siya sa downward trend.
Okay, ang nangyayari right now, kayo ang nasisisi o kayo ang napapag-initan when numbers go up and you start telling people that the numbers are on the rise. But no one seems to be talking about why the numbers or the case reports are going up. Is this because we are finally doing more testing, or is simply because more and more people are landing in the hospitals or in primary care centers or in testing centers?
Well, Sito, for sure we need more testing pa kasi mataas yung positivity rate natin. We're at 27, 28% positivity rate. Sa Metro Manila, we're at 25% positivity rate. So, ibig sabihin, when your positivity rate is that high, kailangan pa lang, kulang pa yung testing natin. So, it's not about doing more testing. I mean, we should be doing more testing, pero it's not because we're doing more testing kaya mataas. You're correct, Sito, na we're seeing more people in hospitals. In fact, part of Father Nick's presentation yesterday sa Go Negosyo, pinakita niya na nag-plateau na yung hospital occupancy natin. What does that mean? Hindi na tumataas yung hospital occupancy even though tumataas pa rin yung cases. And what that means is we're actually at close to full staffing capacity. Ibig sabihin, baka may hospital beds pa, but in terms of staffing, we're at the limit na. Hindi na kayo mag-admit ng patients kasi wala nang healthcare workers na mag-aasikaso sa mga new cases na i-admit nila. So, and this is also what we're hearing from our doctors because we know a lot of doctors na many hospitals are no longer admitting patients.
Okay, so first yung sa testing, okay? So maintindihan, so people can better understand. Positivity rate will go down if the testing numbers increase kasi proportion, kumbaga sa dami ng sinampulan mo, yung positivity rate lumiliit kasi lumalaki yung populasyon. Now, ang nangyayari has nothing to do with the number of tests being conducted because the tests remain low.
Yes.
Okay, so mababa pa rin ang mga pagtetest natin. So ang nagiging dahilan, the reason why we have so many cases is because we have so many cases. And we have so many cases that the hospitals can no longer allow entrance. Kumbaga, full house na kami, hindi na kami pwedeng magpapasok. So even if the real number of cases outside of the hospitals multiplied times so and so, the numbers being reported have remained plateau, hindi nagbago, pumatag na sa ganitong numero because wala nang paglalagyan at wala nang matanggap.
Correct, Cito. And wala nang healthcare workers na magbabantay or mag-aalaga sa kanila. And what we know is medyo understaffed yung mga hospitals ngayon. May mga nag-resign, may mga lumipat, may mga nag-abroad, and may mga na-COVID din sa mga ibang healthcare workers natin. So, nagpapagaling.
Well, I will substantiate that because I've already spoken to two people. One was Dr. Ronjin Solante, who was telling me that for the ratio of staff, nurses to patient is something like every nurse has to take care of at least 5 or 6 patients. And hindi po ito yung nagtitingin lang, nagche-check lang ng BP kasi ito yung mga na-intubate, mga naka-IV, naka-oxygen high volume oxygen, whatever ang tawag nila doon. And then another friend of mine in Pampanga who was hospitalized in the medical city, I think, basta sa Clark, sabi niya, Kuya, hindi na ako tumatawag ng nurse kung may kailangan ako. Tumatayo na ako, binibitbit ko na yung swero ko. Sabi ko, why? What's going on? Private hospital. 30 kami dito. Lilima ang nurse dito sa COVID floor na ito. So, talagang even if the hospitals want to give out the best, they can't find people.
Yes, ganun nga Cito eh. I mean, ano yung pwede nating solution? And they were brainstorming this also yesterday sa Go Negosyo. I mean, when this point was raised by Father Nicanor, they were brainstorming. What can we do? Can we increase yung salaries ng mga healthcare workers para, to get some of them? Can we get mga interns or yung mga, for example, graduating nursing students? I mean, they're surprised now we have a shortage of nurses and healthcare workers because isa actually tayo kumbaga tayong manufacturer ng mga healthcare workers because we produce a lot of nurses and mga people who work in the healthcare industry.
That is so typical of our country because and I apologize before giving the statement. We are so good at exporting products, whether it is actual products, natural resources, or human resources. Parang yung mga ine-export nating alimango, bangus, mga saging, pagkatapos ang natitira sa atin dito latak. At least sa nurses naman or doktor hindi latak, pero kokonti ang naiiwan dito. Instead of the Filipinos being the first to be blessed to have the benefit of experiencing these good services or these great products, ayun, ini-export. Yung natitira dito, kasing mahal pa rin nung ini-export. Parang alimango. Pasensya ka na, Professor Guido. Yan ang talagang hate ko. Yung alimangong paborito ko, hindi ko na mabili sa sobrang mahal, pati yung sugpo. Anyway, I digress.
Pareho tayo Cito. Paborito ko rin yung alimango at sugpo.
Kakapikon, presyong pang-export eh. But anyway, let me go to another touchy topic. Okay, so but before we leave that, so what is the scenario? You said the hospital na ako tawag nun, hospitalization plateau kasi puno na. Okay, number of cases still going on. Do we even have an idea why? Because when they rolled out this ECQ, the game plan was ECQ tayo, 2 weeks, maybe 3 weeks, lockdown, Pagkatapos, that will bring down the number of cases, particularly hospitals, healthcare workers will get a break from the number of cases. In the meantime, we go all out for vaccination. 3 million vaccines available. That will be 1.5 million people vaccinated in 2 weeks or 3 weeks. It sounded like a great proposition. What went wrong?
Well, that's a great question, Cito. I mean, we're also struggling to find out kasi syempre, we also have to look at yung data ng breakthrough infections kasi if a lot of people are vaccinated, sa NCR we're seeing at least 30% ng population vaccinated. I think we're going to around 40% maybe this month or early October, and that's a lot of vaccinations already. And in other countries, that's um, you know, they were able to see, control of cases with sufficient level of vaccinations. Siguro yung Delta variant, that's one of the reasons, yun yung isa sa obvious reasons. And then yung, what we noticed yun nga, during the MECQ period, medyo nag-plateau na yung, yung growth rate and yung reproduction number, meaning hindi na siya masyadong bumaba during the period. So, we're going to give this yung granular lockdown a chance kasi what we're hoping to see talaga is a calibrated strategy, and yan yung gagawin nila sa granular lockdown ito. I mean, I know it's a new strategy, pero from what I hear, they're trying a strategy na baka medyo similar or pattern do sa ginawa ng Cebu City. And in fairness to Cebu City, they were able to control the surge. Ngayon, pababa na yung cases nila. So they were able to do it quickly. So, maybe we could try something different.
Okay, there is such a thing as volume relative to dose. Kumbaga, kasi Cebu City has a much smaller population than Metro Manila. Now, it is easier to treat, contain, and manage Cebu City based on its population and land area. But NCR, you're the statistician. If Cebu City managed to control and bring down their cases in how many weeks? 3 weeks ba? How many weeks or months would it take? Ideally, statistically speaking, kasi may mga titira na naman sa'yo sasabihin, nagmamarunong ka. But statistically speaking, relative terms, how many weeks or months do you think it would take a lockdown or whatever quarantine to start bringing down the cases significantly?
Well, I mean, if we compare to what happened last March, I mean, we were able to bring down cases. Actually, at that time, 3 weeks lang napababa na natin cases. So right
Pero
now,
wala tayong variant na Delta variant nun.
correct. So mas mahirap yung kalaban I mean, mas malakas yung kalaban natin ngayon. And you have good points then. Cebu City has a population of 1 million. Para lang siyang, I mean, it's just slightly bigger siguro than Taguig. NCR has a population of 14 million, much more dense compared to Cebu City. I think yun yung points mo. So these are not direct comparisons, pero well, I'm still hoping na by October pababa na yung cases natin actually. I mean, I don't know, what I'm clinging to there, pero it's more to do with the normal period of a surge as we have seen. Yung mga countries naman na talaga na prolong yung increase ng cases like US and UK because they have actually adapted a different strategy na gusto nila masks off na sila talaga, parang gusto
Yeah.
na ipilit yung old normal. Tayo naman, hindi naman tayo ganun. We're still compliant with minimum health standards. So I'm still baka by next week baka iba na yung tune natin, baka mas maganda ng numbers. We might still see a higher number, pero if what we're seeing right now, I'm seeing early indications na baka the positivity rate has plateaued. Pag nag-plateau na siya, baka pwedeng magsimula na siyang bumaba. So there are things na I'm holding on to right
Okay.
now, And baka by next week, we'll have a clearer picture.
Okay, Professor Guido, just a few pointed questions. No? Because I already made the comparison and you answered it. Cebu versus NCR. Cebu only has a 1 million plus population. NCR has 14 million. So, mas malaki yung problema. Now, in terms of COVID-19 original versus COVID-19 Delta variant, in terms of ability to infect, transmit, how many times ang reproductive rate ng COVID-19 versus the Delta variant? Medyo pasensya ka na, mat 11 times 7 ko. Parang ganun ang ginagawa kong relevance eh.
All right. Well, if we look at yung original Wuhan virus, it was a reproduction number niya is about 2 to 2.5 in its natural state pag walang face mask, walang social distancing. And then yung Delta variant, it's anywhere from 5 to 9. Sabi nga nila ka-level ng chickenpox. So it could be parang 3 to 4 times more infectious than the original strain.
Okay, now does any of the, because again, I wanted to hear it from you, you're getting your data from the DOH. Hindi kayo namumulot kung saan-saan, correct?
Well, yes, pero we cross-check it sometimes with LGU data, and of course we get some data on the ground from yung mga hospitals because we work with some doctors.
Okay, so kumbaga cross-reference lang, hindi yan add, kumbaga i-cross-check lang. Okay, now, having said that, what is the population of the unvaccinated in Metro Manila or the NCR? Does the DOH data provide that to you?
Population of unvaccinated, well, we can estimate na if we're at about 30% vaccinated, fully vaccinated, that's more than 4 million. May mga nagpo-provide nitong information nito. In fact, Father Nick has some access to it. So I think
but let's qualify that mathematically, Professor Guido, no? Kasi sinabi mong 30% ang vaccinated, so that would mean the unvaccinated is 4 million. Pero that does not include the 18 below population, which is 40% of the Metro Manila population or the national capital or the national country population, correct?
Correct. And so pag i-estimate natin, maybe 9 million pa yung unvaccinated or something like that, maybe 8 to 9 million.
8 to 9 million sa Metro Manila lang?
Yes.
Okay, so there is an because if you have 14 million Filipinos in Metro Manila and 9 million are unvaccinated, then yung gumagalang 9 million na yun, kahit kalahati lang doon ang gumala or 1/4 ang gumala, milyon ang nagkakalat ng Delta variant na yun if they have it.
Correct.
Or the potential to spread the disease.
Correct. And that's why,
Go ahead. That's why?
Yeah, that's why isa sa mga, talagang ina-advocate natin even before pa yung mass randomized testing. Kasi kung may mga kumakalat tapos hindi natin natetest sila, hindi natin alam kung sino yung nakapagkalat ng virus. Pero again, we know that there's trying different strategy. Baka naman this would work.
Okay, well, the reason I'm pointing this out, ladies and gentlemen, is because we're not talking figures. Dahil may mga ilan dyan na so-called experts na sinasabing si Professor David at yung OCTA Group daw are speaking on areas that are not their expertise or concern. But as you have heard today, we're only talking about numbers, and numbers don't lie. So if you have a population of 14 million and 9 million are unvaccinated, and even if 1 million or 500,000 of those have COVID and they go around, what are the chances of wiping out COVID? Probably not in this year at the very least. Now, as far as your projections are concerned, you said you are not hopeful that things that we have reached the peak, hindi pa tayo nagpi-peak. How much longer will it take for us to peak, and what will be the impact of the vaccination program spearheaded by the government and Joey Concepcion's group?
Well, the vaccination has already had an effect kasi napababa niya yung reproduction number. Pero that's a good question, yung peak. Yung previous projection namin, we were seeing na second or third week, and obviously nasa second week of September na tayo. But I'm still, like I said, I'm still holding out hope na baka this coming week, third or before the end of September, makapag-peak na tayo and pababa ng cases.
When you
So,
say, yeah, when you say makapag-peak, are we talking about that often quoted that figure of 30,000 in one day?
it's possible hindi natin maabot yun, Cito, but it's in play. Ibig sabihin, it's also possible maabot natin yun. Pero, the next landmark siguro, like 35,000 mo ang imposible kung magpipeak na tayo. Pero yung 30,000, possible naman yan na we could see that in one day
Yeah,
before the end of
but
the month.
Professor, if you're correct, and you say that the infection or rate of infection or transmissibility of Delta variant is at 5 to 9 per unit, kung meron kang 20,000 na lang sa ospital, does it necessarily follow that on the conservative side, we can multiply that? Wag nang 5, i-multiply na lang natin by 3 or 4. Ano ba yung mathematical conservative figure that of the number cases that are not in the hospital but are malingering around? Kumbaga, kung saan-saan namamasyal, pero may tama na pala.
Yeah, pero Cito, we can't estimate kung ilan yung malingering na yan unless we do more randomized testing. I know some mayors are
Ah.
doing that. Yes, kasi itong sinasabi nating estimate like 500,000. These are just estimates, but we don't know the real figures. Pero if we do sampling, kahit sampling, mag-test tayo sa isang location, makita natin kung ilan yung positive dun, then we have an idea kung ilan yung lingering around, and then we can multiply. Kahit sabihin natin na 1.4 na lang multiplier natin because we're wearing face mask and yun yung na-observe natin na reproduction number, at least we can estimate pa rin kung ilan yung kumakalat. But we would need a serology survey to have some data.
Okay, so you are just working with the figures at hand, but unless the national government and all the LGUs do a large amount of testing, hindi natin masasabi. Gaano karaming testing, ang random testing required per LGU in terms of population? Kasi may nagsabi siya, si Tony Lechon, sabi sa akin, sa amin here on agenda, that every LGU should do 10, or the government should do 10 to 20% of the population.
Well, I have to check the figures. 10 to 20% seems reasonable, pero I'm not sure kung attainable yan kasi 10% of the population, that's more than 1
10
million.
million.
Well, I mean, kung sa Metro Manila lang tayo magko-concentrate.
Okay. Sa Metro Manila lang, di 1.4 million kung 10%.
Yeah, that's right. That's 1.4 million. I mean, do they mean 10%? Hindi naman obviously 10% every day, pero even 1% every day, kunyari 140,000, that would be, I think that's fair. Kasi right now we're testing sa buong Pilipinas, we're only testing mga 75,000. Kung
Wow.
ideally, we should be testing at least double that. Hindi pa randomized testing yan, parang lang yan. Yung
Okay.
testing natin dapat mga 150,000 per day sa Pilipinas, at least sana.
Okay, well, thank you very much, Professor Guido David, and please continue to do the good work, the valuable information that you share. Huwag kang magpapabuli, at kung may nambubuli, tawagan mo kami. Mas magaling kaming mambuli ng mga bully. Thank you very much. God bless you and protect you. Have a great day, Professor David.
Have a great day, Cito. Thank you so much for your support.
Okay, and that is Professor Guido David of the OCTA Research Group. Pagdasal niyo po sila that God would surround them with His hedge of protection because may mga tao po, may mga politikong ginagamit ng ilang personalidad to stop the OCTA Research Group. Not because they're bad people, but because it seems there is a conflict of interest between what certain people in government want to do. Kumbaga, itong lockdown, etc., shifting from the quarantine categories to granular lockdowns, naglalabas naman itong OCTA Research ng data na ang hirap substantiate or does not support or does not give logic to what the government wants to do. Kumbaga, granular lockdown ka, magpapalabas ka ng mga tao para sa ekonomiya, yung mga kaso natin mas mataas. As my wife put it, you guys did the ECQ when you had 2,000 COVID cases. Now you have 20,000, 20. Yeah, 20,000. Ano ba yung lumabas kanina? 20,000. It does not compute. At 2,000, we declared ECQ. At 20,000, we want to do granular lockdown. Go figure. Anyway, let's go to our next guest. Let's talk about livable, lovable. Livable, lovable places. She is an urban planner, coastal resource manager, and biologist by profession. So, hindi lang po journalist, mascom ang trabaho sa pwede niyong piliin on nursing. Pwede niyong pag-aralan yung urban planner, coastal resource manager, and biologist. Serves as livable and sustainable cities campaigner of Greenpeace. Let's talk to our resource person, Ms. Rhea Jane Pescador-Mallari. Good morning, Rhea. Jane ba o Rhea?
RJ na lang po.
RJ. Okay. Sorry, RJ. Medyo hindi ko nakuha yung nickname. Okay, RJ, thank you for joining us and maraming salamat sa panahon mo dahil, alam mo, every time lumalabas yung mga survey of most livable cities, parang halos malaglag na lang tayo dun sa listahan And I kind of wonder, how on earth do they even determine what's livable and lalo na lovable cities in the world?
Yeah, actually, yun pong mga ranking na yun, parang lagi po tayong nakasabit dun sa huling listahan. And yung pong way para malaman natin yung livability and lovability ng isang city ay depende po sa tao kung nasan siya, kung paano po natin i-rate. Kasi yung livability po, maraming mga criteria that we can actually use. So one of the criteria for people or even studies and researchers use as criteria is one would be yung GDP, if people are actually earning enough, and then second would be the well-being and social services, or the social services are strong enough to provide yung mga pangangailangan ng tao like basic housing, food, water. So yun po yung parang ang concept nun is mabubuhay ba tayo dun sa lugar kung saan tayo nakatira. But the concept of lovability doesn't have a specific box criteria. Parang kayo po, paano nyo po ba masasabing mahal nyo ang inyong asawa? Paano po ninyo sinabing ito yung criteria ng pagmamahal nyo? So when you do indexing or rating ng city in terms of lovability, it's subjective according to emotion ng tao. So yung emotion ng tao na yun po yung hindi natin ma-quantify.
So, lovable, yung livable, alam natin, maganda ba yung tirahan, yung do you have basic services, medical, you have utilities, etc. And ang pinakamahalaga, may trabaho ka ba na allows you to afford, yung kaya mong bayaran at mamuhay sa isang lugar. In what areas does the Philippines fall?
In what area po? In terms of
kasi
lovability and
livability kasi pwede ko nang umpisahan maraming lugar sa Pilipinas na isang kahig isang tuka ang tao or walang trabaho or maswerte na kung maka-extra ng 2 araw.
Yeah, dito po sa Philippines, nakita naman natin most of the journal. I think yung pinaka-latest kong nare-recall when yung world ranking ng Manila in terms of livability, sobrang napakababa. So, kung titignan po natin yung mga urban cities natin in the Philippines, the same scenario actually yung makikita natin. We all see all sorts of urban injustices. Yung urban injustices po na parang ang hirap mabuhay, ang hirap humanap ng makakain ng mga ordinaryong tao, especially yung mga yung latest news na nabasa ko kahapon, parang we have the lowest po na cost of yung mga grocery items. Parang tayo yung pinakamababa. But we can't afford to even eat a decent meal because of the yung ating low income or wage. Napakababa po ng ating wage compared to our neighbors. And yun, we all see this problem in urban areas that are very dense, especially Metro Manila. Nasabi din po kanina na very dense yung urban setting natin in Metro Manila. And lockdowns and mga social distancing, hindi mo makikita yon. It's a luxury to ordinary citizen living in places like Metro Manila. How can you even ask someone to have 1 meter social distancing if their house is just 10 by 10 meters? So, yung pong ating basic na 10 by 10 meter na housing unit, paano pa po tayo makakapag-social distancing if we have 5 members in the family? So, it's a luxury and it's a test of whether or not we are living or loving our city.
Okay, now we can highlight all of the problems. Maraming problema. As I started the program this morning, I pointed out that according to an urban planner architect that I read from, forget Metro Manila because it's a dying city and you are better off living outside of Metro Manila. Kahit na hindi as developed, you will live longer. Now, what solutions? I understand you are a campaigner for Greenpeace. Ano yung mga kinakampanya nyo? Kasi hindi naman kayo yung mga makibaka. Di ba? You are campaigning for the betterment of society, not political in nature. What are you campaigning for?
Currently, Greenpeace Philippines po have many various campaign under the Better Normal, Better Cities campaign. Pero the umbrella campaign that we are actually prioritizing is climate justice and just transition to renewable energy, plastics, and livable and lovable city. So, aside from that po, we are marking our 50th anniversary. Greenpeace has it's been 50 years since Greenpeace started campaigning, and this 50 years mark of Greenpeace advocacy is not a celebration but a call to action for people, government, and communities to look at climate crisis and pandemic around us. We want to encourage people to get involved, support frontliners, artists, ordinary citizens who are demonstrating solutions in their community to transform our cities for better.
Okay. RJ, let's go for a quick break. And when we return, I'll give you more time to elaborate on those things. We'll be right back here on Agenda. Okay, welcome back to the program agenda. I'm your host, Cito Beltran, and you are watching us via Cignal TV, channels 8 and 250, and YouTube, as well as on Facebook. Let's go back to our guest, RJ Pescador-Mallari. RJ, paglilinaw lang po mga kaibigan, mukhang may alaga kang manok dyan sa likuran, Ah,
Opo,
Okay, yung tumitilaok pong manok, kay RJ po yun, hindi sa akin. Kasi
opo,
dito
sa'kin
po,
po.
ang manok, hindi, okay lang. Ang manok dito, pag tumilaok, tinola. Okay, okay. But no, I just like to put humor into it. But seriously, RJ, you're talking about climate change. Maraming mga misconception ng tao eh. Pag sinabing Greenpeace, kayo yung mga bodyguard ng balyena. Pag sinabing climate change, sinasabi na, ay naku, ano ba yung climate change yan? Umulan, umaraw, pareho lang yan.
So, madalas po maraming mga ganong tanong, lalo na po yung mga parang hindi pa talaga nire-recognize that climate crisis is here. Kasi parang in a way, parang dati naman nararanasan na natin yon. And agree na nararanasan natin ngayon, but the intensity today is greater than the past. So parang halimbawa po, nagkaroon ng bagyo nung nakaraang taon o nakaraang siglo o kailan pa man nare-recall natin, hindi po siya ganun ka-intense, hindi po siya ganun ka-frequent na nararanasan ng mga tao. At yung aside from yung mga climate disaster po, yung mga bagyo and super typhoon, climate crisis din po is manifested dun sa mga systems na meron tayo kagaya ng agriculture. Affected sila ng climate crisis. Yung pong ating mga source of water. So bakit parang lagi tayong nauubusan ng tubig tuwing summer? So lahat po ng mga systems na ito that we have is connected to climate change. So again, kahit nararanasan natin the same problem of the past, hindi na po siya ganon kabigat or hindi ganon siya kagrabe at ka-frequent kagaya ngayon.
Okay.
So,
Naku, mga kaibigan, I just want to support what RJ pointed out. If you watch some of the documentaries, particularly in India, some parts in Southeast Asia and other continents, marami pong lugar yung kanilang rice field ay pinasok na ng salt water. O yung kanilang rice field nawala na ng water, etc., etc. And then now, never before, yung na-experience in Germany, Belgium, in New York City, where binabaha sila. Naalala ko tuloy yung advertisement na wala kayo niyan sa Pilipinas, wala kayo niyan sa Pilipinas. O baha, meron din kami niyan sa Pilipinas, di ba? Okay, anyway, RJ, so climate change is a very important matter for even for Filipinos because it affects our agriculture, even our lifestyle na apektuhan. But what can Filipinos do? Kasi sinasabi ng marami, ano ba magagawa namin kahit na magsisigaw kami? Walang pakialam yung Russia, yung Amerika, yung China. But a few minutes left, or down to 2 minutes. What can Filipinos do? And I promise, babalikan namin.
okay, so lagi pong tinatanong yon, anong magagawa natin na small dust lang tayo sa parang malaking problema na to. And I just want to emphasize that even as a country, napakaliit po ng kaya nating i-contribute sa climate change emission. Tayo po yung pinaka-konti yung nagbibigay na emission sa mundo. Pero tayo po yung pinaka-vulnerable. Tayo yung konti yung na-contribute, pero tayo yung mag-suffer. This is also equivalent, parang mas madali nating maintindihan. Para lang din po yung sa COVID eh. Yung mga times na inequality during the time of COVID, na-amplify siya. So yung time na parang lahat po ng mayayamang bansa started to buy yung mga vaccines for their population, nauubusan po yung mahihirap na bansa. So ganun din po yung nangyayari sa climate crisis. So ano po ang dapat natin gawin bilang tao? We look for the ones in power. So kung hindi po natin kayang gawin on our own right, we use our power, our voices, para po marinig tayo ng gobyerno na merong mas kapangyarihan para sa atin, para mag-speak out para sa atin. So ano po yung gusto nating hingin sa kanila? Una, kailangan po yung mga commitments natin sa Paris Agreement. The government committed to to use climate mitigation and adaptation sa ating mga proseso sa gobyerno, sa ating pong pagmamanage ng resources natin. So dapat hingin po natin yon, yung accountability and responsibility sa gobyerno na yakapin yung mga commitments na to. And
In other words, we as the ordinary citizens should make climate change an issue of concern, especially in this coming election. Kasi parang binabaliwala yung climate change. Puwera na lang kung tumama ang Yolanda, tumama ang Kiko, mabuti na lang dinaplisan lang tayo ni Kiko kasi kung hindi, luto tayo. In any case, RJ, this is just a sample. Sample pa lang ito. We will try to reach out to Greenpeace on a more regular basis because honestly, I myself am only becoming more involved with these issues of climate change, livability, housing, kasi yan yung mga agenda ng agenda. And okay, so we've run out of time, RJ, but I will make it up to you. Sorry medyo ang hirap ng dalawa bisita. Namamangka ako sa dalawang ilog. Thank you very much, RJ, but more power to Greenpeace, and we will give you more airtime, God willing, and management willing. Thank you very much.
Thank you. Thank you.
Okay, yan po si RJ Rhea Jane Pescador-Mallari, and I'm Cito Beltran thanking you for joining us. Remember what RJ said, make climate change an issue online, social media, and in the elections because it is here. It is affecting our agriculture, our lifestyle, and our economy. Have a good day. God bless all of you. Please keep it here on One News PH.